Since I last spoke to you, we've had one confirmed case in North Carolina now that was confirmed at the CDC laboratory in Atlanta in an Onslow County person. We anticipate that the spouse of that person will be confirmed either later today or tomorrow. In addition, we are investigating a cluster of cases in the Craven County, Carteret County area that are all associated with the same work site, and one child from one of the adults in that cluster. Because of that child's illness, and these are now probable cases, that is, they had unsubtypable type A influenza, we decided to close that elementary school in Havelock. So Arthur Edwards Elementary School is closed today for the remainder of the week. This is until we better understand what that cluster had, what was going on, and to prevent any transmission in the classroom in that Craven County community. The other probable case in Wake County tested inconclusive at CDC. We'll have another test on it run hopefully today. And that brings us to 7 probable cases in North Carolina. Meanwhile, our lab has been busy as ever. We've tested about 440 specimens now, of which 382 have been negative. Currently, what we're trying to do now is to limit the testing. Because influenza-like illness is a very common disease, we would like now for physicians to limit their testing to severely ill people. So these are folks coming in with influenza-like illness, but are sick enough to be hospitalized, usually with respiratory complications, cardiac, some other underlying condition that requires them to be hospitalized. These are the folks that we're really interested in getting tested now. And those samples should be run through your hospital networks. So if, as the admitting physician, you can let your hospital know, they can get the nasopharyngeal swab sent through the hospital laboratory network to Raleigh for testing. The other area of interest that we would encourage physicians to test is in what we call high-risk transmission settings. So if you're seeing a patient in the outpatient setting who you're not going to admit, but is associated with an outbreak or a cluster in your community, or is in a high-risk setting like a nursing home, a daycare center, or a school classroom, that's another person that we would be interested in you getting that nasopharyngeal swab in your office practice, calling your local health department, and getting it routed to Raleigh for testing. The last thing I wanted to say is that we do have the reagents in now in state for confirmation of this new H1N1 type A virus. So our folks in Raleigh will be able to do the test in state. That should increase our turnaround time greatly, so we won't have to send it on to CDC.